We're going to do a splint for any type of distal radius fracture or radius fracture dislocation. We're going to be doing a Volar-Dorsal type splint. So any patient that comes through the ED that has any type of wrist fracture, this should be appropriate for. And before we do any of these type of splints, one thing you want to pay attention for is any type of jewelry that's on the wrist or the fingers, so make sure we remove that before doing any type of splinting. And also doing a neurovascular exam, checking for radial pulse, and then also checking for any type of numbness or tingling in the fingers, especially for distal radius fractures, concerned that there's any type of median nerve compression. If there's concern there's any neurovascular compromise, definitely make sure you consult orthopedics. But for any basic distal radius fracture or neurovascular they're intact, the splint should be appropriate.
Okay, so prior to putting on the splint, what you want to always make sure is that not only is the patient in a comfortable or neutral position, you want to make sure that the thumb is aligned with the radius and the radius is aligned with the humerus, making a perfect kind of L shape. But also you want to make sure that the skin is clean and that there's no open or like puncture wounds or anything like that. So always make sure that you clean off the arm before you do so. If you have cast padding along with you, you want to make sure that you measure the amount of splinting material that you're going to use by going 2 finger breadths above the antecubital space. And then you don't want to pull the cast padding, but you want to just gently lay it around. Go in between the index and thumb when you're measuring, and then you go back down to 2 finger breadths above the antecubital space, and then you can just tear off cast padding to allow the proper measurement for the splint. Now that you have the appropriate amount of measurement for the cast padding, with the cast padding for the splint, you can just cut right through. Always make sure that whenever you cut from the massive roll of splinting, that you always seal off the remaining package, so that way air doesn't dry out the rest of the roll. The whole roll can dry out in a matter of a couple of hours, so you always want to make sure that you seal it once you're done cutting it. To wetting your splint, you always want to make sure that the wrist is not only in the proper position, but also that you're putting on cast padding prior to putting on the splint. Because the splint already has padding on it, you don't need to put a large amount of padding around the wrist or on the arm. This is mostly not only to just protect the skin, but also just to help pad the skin. Also, you only want to put 1 or 2 layers of cast padding at the fracture site, just that way you don't over pad the wrist. If you accidentally over pad the wrist, what can happen is as the swelling goes down or as the padding gets packed out, that it can start to allow the wrist to move inside the splint, and any reduction that you have done, you will lose over time. This will progressively not only get more painful for the patient, but also this will possibly make them have surgery if they are a patient that is trying to avoid surgery. So make sure that you don't overpad the wrist. That being said, you always start at the wrist when you use cast padding. You can use 2 or 3 inch cast padding, whichever one works easiest for you, just as long as you're not over padding the wrist. You can always just tear off a little bit of cast padding, just that way you're padding appropriately in between the index and thumb. When it comes to getting up to the palmar crease here, you can put just 2 layers of cast padding right around that area. Since we want them to move their fingers as much as they can tolerate, we want that area to be well padded and not get rubbed or chafed by any of the fiberglass or the splint. Once you've wrapped in between the index and thumb and around that palmar crease, you're just going to immediately just try to wrap below where you started, so that way you're not worrying about over padding the wrist. As you're wrapping on this cast padding, you're making sure that you don't pull and wrap. If you accidentally pull and wrap on the splint and cast padding, this can also not cause compartment syndrome, but this can make the splint too tight for the patient and can cause circulation loss possibly in the future, especially if they're not elevating as much as they should be. When also using cast padding, you're going to be wrapping past where you're putting the splint on, so that way you can have nice padded edges. This will make things easier for not only finger movement, but also whenever they're moving their elbows, so that way that area doesn't get chafed or rubbed or even scratched. You can just use about 2 to 3 layers of cast padding around the edges, so that way you have well padded edges. Prior to putting the splint in the water, when you see these little edges here poking out past the padding, you're going to want to open up the padding here, and you can just simply cut off about an inch or maybe a half inch, just so that way you still have a good amount of padding that's going past the splinting material. When that splinting material starts to harden up, it can easily cause like a lot of scratches. Sometimes the barbs in the splint can also get into the patient too, cause like a fiberglass splinter. They'll be very difficult to not only take out, but can also cause an infection. So you always want to make sure that the padding with the splint is also making a nice padded edge. And if you want, you can either fold the A-strap, or you can just cut it in half, leaving it a little bit left, and then folding it on itself to allow just getting in between the index and thumb. Then you're just going to continue just to wrap a splint down the arm. There's no need to do what some might call a 50-50 roll, where you're overlapping 50-50. You can just get it to where it's just covering the entire arm. It's also okay just to tuck in some of the cast padding around the edges, just so that way the A-strap is holding in all the cast padding and preventing it from falling out. By the time you're done with the splint, you should be able to clearly see the palmar crease, and you should be able to allow good flexion and extension with the patient's elbow. After this, you want to do just an interosseous mold where you're just squeezing from the wrist all the way down the arm. This allows the fracture to be able to just stay mobilized and stay in place, so that way it's not moving around too much. After this, you're also going to want to inform the patient that they not only need to keep on the splint, but they need to keep the splint dry. You can use a trash bag, bringing it up past the elbow, and use a rubber band to seal it off. You can also tell them to tuck a towel along the edge of the splint, so that way if any water leaks through, the towel will be able to absorb the moisture. You can also tell them to go to CVS or Walgreens to get some cast cover bags. That will work as well. That's basically it. I'll